Hi, my name is Ellen Tedaldi, and I'm a primary care physician here at Temple University Hospital, professor of medicine, and I actually direct our HIV program. And I've been at Streetside on and off since the 90s, so I have a few years of experience working there and precepting with Temple medical students on Thursday afternoons. Um, these are primarily first and second year students, so this is often one of their first opportunities to meet with real life patients and learn a little bit about the importance of trying to get patients engaged in primary care. Several of the patients may have HIV, hepatitis C, as well as other chronic medical conditions. And so one of the things that we try and emphasize with them is, do they have primary care services available to them, and if they do, why aren't they using them right now, or what have been some of the barriers for them to get to a primary care provider. And that's one of the things that we often will discuss with them, and in some cases actually identify some chronic conditions in addition to what they may know about already, HIV and hepatitis C. But find out that they may have asthma when we talk and examine them, or high blood pressure, all of which need ongoing chronic evaluation and services. And that part of their long-term game plan, in addition to dealing with maybe their substance abuse or mental health issues, are dealing with some of these other medical problems. And this is often an opportunity for them to have a chance to talk to medical professionals about it. We often hear that it's difficult to access their physicians, or they have to go through a lot of hoops getting recertified, and may often fall off care and need to have those readdressed. We find out that for some of them, especially if they may have been incarcerated or in and out, that their insurance has lapsed, or there's been other issues, transportation, a variety of other things. So being able to see them street side often gets them started on thinking about returning back to care, and also letting them know where there might be nearby services so that it makes it easier for them to hook back up with primary care. One of the things that when the students are evaluating the patients, they have an intake sheet and sort of a progress note. And for them, this is often the first opportunity they have to see the types of questions that you need to do in primary care, but also opens up a conversation about various things that may be going on with a patient that it's important to get addressed in a primary care office, and make sure that some of these vaccinations, again, HIV, hepatitis C, that may need to get taken care of. The other thing is that as we're talking about it, it often enables us to say, healthcare is often a team sport and team-based approach, so that there's other services that they can get through Prevention Point, social work, maybe connecting to other substance abuse services, social work services, that will enable them to get the other aspects of care that they need. And so I think that's part of them being able to see that it's a multidisciplinary approach to primary care. And I think one of the important things that, especially when they're early on in their medical career, is to see some of these patients who may be having active mental health issues, active substance abuse issues, in a setting other than a hospital, so that they start to learn how to destigmatize some of these, and that what people really often need is information, good quality assessments and care, and that it's not often about making a judgment about what they're doing, but it's really trying to give them a much more positive approach to dealing with these patients. And I think the other thing that's important is, as they're taking the histories and learning, is to understand sort of the context for these patients, what has been their life experience, what's been their life narrative, how they end up sort of in this situation. But that really, above all, mostly what you want to do is be giving them good assessments and information about what they need to do for long-term care management. And that prevention is important, that if we're seeing you now and that you can get re-engaged in care or engaged in care, it will be a lot better than waiting till the end stages of a lot of these conditions like HIV and Hep C. And also doing the vaccination, the importance of prevention, primary care. And I think certainly right now in 2014, to be able to talk to patients who long ago really hadn't considered getting treatment for like hepatitis C, now there are so many new options that it's really important to sort of get everything together, try and get into substance abuse treatment, as well as knowing that there's new therapies available for hepatitis C. And that part of that is really getting yourself sort of prepared and ready, getting your vaccinations, getting the substance abuse addressed so that you can get these new life-saving therapies. And to talk to people about curing hepatitis C, which really hadn't been an option for many years and is now available to them. So I think that hopefully will get them excited about getting rehooked up into primary care or getting themselves into primary care from the get-go.